Chemotherapy is a medicine that's used to treat lung cancer, and it's most commonly given intravenously as a drip treatment into a needle in a vein in a person's arm, although sometimes it can also be given in a tablet form. Chemotherapy actually works by attacking cells when they're trying to divide and multiply into new cells, so it interferes with that process and thereby kills the cancer cells. But because it attacks cells when they're dividing and multiplying, it can also do that to some normal cells in the body, and that can be responsible for some of the side effects that we see with chemotherapy.
The first time I had it, the chemo was terrible. I was sick, couldn't eat, was really sick.
Some people who've had an operation for lung cancer might be recommended to have some follow-up treatment with chemotherapy afterwards. And the idea of using chemotherapy in this situation is to mop up any little cancer cells that maybe have been left behind after the operation. The other setting in which chemotherapy is used is together with radiotherapy. And in that setting, we often use quite low doses of chemotherapy during the radiation treatment. And it's been shown that in that setting, giving the two treatments together often works better than just using the radiation itself.
He said to me, Dr. Ball, now in Australia we like to give the radiation and the chemotherapy together. He said some places don't, but we find that gives the best results. But he said it is very severe and you will be sick.
Well, when I was on chemo, I was lucky I didn't have very many symptoms. My hair didn't fall out. I didn't get nauseous. I just whacked on a lot of weight, a lot of fluid. Had restless feet syndrome, which nearly drove me nuts, especially in bed.
And the third setting in which chemotherapy is used is in the patient who has advanced lung cancer that can't be cured. And in that setting we use chemotherapy to try and shrink the cancer down as much as possible, and by doing that hopefully improve the person's symptoms and their quality of life.
6 months chemo. It wasn't as bad as I thought it would be. I'd have 2 or 3 days where I wasn't really well, but I'd force myself to walk the dog, even if it was only around the block, and keep going.
The side effects that people get from chemotherapy vary depending on the particular drug that's given to the patient. So some drugs will cause some side effects and some will cause different ones. For example, hair loss is a side effect that we do see with some chemotherapy drugs, but other drugs might just cause a bit of hair thinning, or other drugs cause no hair loss at all. Some of the other common side effects of chemotherapy include what we call fatigue or tiredness, and also it's quite common to have problems with the bowel. So some people can get constipation and other people can get diarrhea.
They make your taste a bit funny. Your nose smell the thing a little bit funny, like a pregnant woman, I can say it. Because when you want to eat something, you feel, oh, yeah.
Another common side effect that people are very afraid of is whether they'll get nausea and vomiting with their chemotherapy. And again, some drugs are more likely to cause this than others. But with drugs that we know that could cause nausea and vomiting, what we do is before chemotherapy we give people a pre-medication of drugs to prevent nausea and vomiting. And we give some medication on the day before the chemotherapy, and then we give some extra tablets for people to take home and use in the couple of days after treatment to prevent nausea and vomiting.
I was quite sick, nausea, and extremely tired. But it only lasted 3 or 4 days and I'd be fine.
It's also important that we advise people to look out for any sign of infection, because we know that when people are having chemotherapy, their immune system is going to be somewhat suppressed. And this happens because the chemotherapy will temporarily lower the levels of the white blood cells in a person's body. And white blood cells are a type of blood cell that we use to fight infection. And we know after chemotherapy that the level of these cells will fall and then it will rise back up again as the person's always making new ones. But when the cell counts are low, people can be at risk of infection. So we get people to monitor themselves for this by having a thermometer at home and checking their temperature on a regular basis, or if they ever feel unwell. And we advise people to contact the hospital or their doctor straight away if their temperature ever goes above 38 degrees. So it's important that you talk to the doctor about what the specific side effects are for the particular drug that you might be receiving. There's a number of additional resources such as booklets or fact sheets about chemotherapy that people can get from their doctor or their chemotherapy nurse.